Hi everyone, welcome to the Menzies School of Health Research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices, where we aim to hear from young people and specialists about youth health priorities in the NT. A special shout out to our sponsors for this event, including Hot North, CDU, the Northern Territory Government, NTPHN, Bridging the Gap, AIMhi Corporation and Charter Air. I'm Lateesha Jeffrey, and today on episode 2, I'll be having a chat with Tricia Nagel, who is a professor at the Menzies School of Health Research. Professor Nagel has 30 years experience in the Northern Territory as a consultant, psychiatrist, educator, researcher, and leader of the Aboriginal and Islander Mental Health Initiative, otherwise known as AIMhi. A collaboration with local Indigenous service providers and researchers, the AIMhi program develops and evaluates mental health resources. The AIMhi research and training program has resulted in changes to guidelines and routine care in Indigenous mental health and rural and remote mental health care across Australia. The team delivers training workshops to diverse primary care and specialist settings in the NT and across Australia, focusing on the Stay Strong app and related culturally responsive e-mental health resources. Welcome to the podcast, Tricia, and thank you for joining me. How are you going today?
I'm going really well, thanks, Lateesha. Lovely to be talking to you. And here I am in the tropics, beautiful weather outside.
Yes, we do love it up here in the Territory. That's really good to hear as well. So, Tricia, can you please tell me a little bit about yourself and the research that you do at Menzies and about the AIMhi program?
Yes, I'm a psychiatrist. So one of the things I was aware of as I worked as a clinician was how tough it can be for some people to actually access early treatment, early information. That means you don't end up so sick you need a psychiatrist and formal mental health services. So with especially some colleagues, some Aboriginal mental health worker colleagues, we wanted to actually journey into research so that we could try out some different approaches. And it's turned into a program which is about tools, resources, pamphlets, fact sheets, just ways of delivering that message and then testing those. You know, we wanted to see whether they work. So there's been quite a journey in terms of talking with people and measuring the outcomes. And we're also training, as you said. So we run workshops specifically related these days to digital mental health.
Wow, that's absolutely amazing. And I know that you have a few projects on the go at the moment, which are focused on young people. So one of those is called the AIMhi for Youth project. So can you tell us a little bit about what this project is and what it hopes to achieve as well?
Yeah, so it's very much of the day, this project. We realised that for young people, you need to take the resources and the information where they are, and they're online. So digital mental health seemed like the go, but what this project has been about, it's now in its 4th year. So it's been 3 years of consultation, asking young people at schools and also some of them in rehabilitation services. So a broad spectrum of young people, urban and remote in the Territory, and asking them what they thought mental health meant and how they thought messages should be delivered, and then quite specifically asking for their help to design an app for use. And that's where we're testing that now. We're doing a feasibility study with Headspace and still with schools and checking how it's going, measuring those outcomes and hoping to be able to move to the next stage of even more formal testing to check that it's really a safe and effective tool for young people to use.
Oh, wow. So we are no doubt in a COVID world at the moment. And what do you think are some of the main mental health challenges, facing young people right now, and how might some of the resources you've talked about, including digital mental health resources, help? So you've already spoken a little bit about it, but
yes, well, for young people, there have always been those challenges of moving from that space of sort of the safety of home into the important stage of being a young adult, out in the world yourself, having your own identity, not just being of your own family, but thinking about setting up your own family. So those changes actually occur pretty quickly. So young people are under a lot of pressure anyway, and then you throw in COVID and then throw in some elements of climate change and, you know, the sorts of natural disasters that we're seeing, and also the politics of the moment. And you end up with quite a challenging time for young people. And they also can find it quite difficult to understand how to get help, to also, you know, navigate waiting times and costs of mental health services. It can be quite tricky. So from our point of view, digital mental health resources, speaking in the language of young people, those that have been developed well, fit with their culture and with their language, they're the ones we're wanting to promote, to give some very clear and plain messages. So we support websites such as Head to Health, such as WellMob, such as our own website, Strong Country, Strong People, and share other resources that people have developed that we think will help young people to navigate those difficulties and find just plain, simple information, tips for help, as well as formal health service tips.
I like it. So, and there are, you know, young people in regional and remote areas, and Aboriginal and Torres Strait Islander people, they obviously face a lot of additional challenges in accessing, and specifically mental health care. Can you tell us a bit, I guess, some of these challenges, that what they might be, and how some of the resources you have developed will help them to overcome some of these challenges as well?
Yes, well, certainly back when we were starting the AIMhi program, one of the issues was for remote communities that we didn't have many services out in remote communities. We didn't have easy access even to GPs. Still, GPs will be under pressure, to psychologists, and although they're out there, they're under pressure and there are only a few. So actually linking people with services, making them more accessible, just related to the geography, was one step we needed to make, and that's where digital mental health services come in. But also clearly the issues of stigma are still really big for mental health. People are ashamed of having a mental health problem and talking about it. And we, along with, thank goodness, you know, nationally and internationally, a big push to help people to overcome that stigma and not realise it's them, because what I mentioned before, so many of the challenges are external and not just us, you know. Yes, it's a tough world. And then literacy and language are big ones as well. So winding it right back and creating simple messages, using plain English or people's own language if we can, because certainly in the Territory, many people are speaking English as a second language, not as their first language. They're the sorts of things. The other big change that we brought, and of course other good workers in this space are bringing, is that sense of a holistic approach to health, mental health, well-being, that it's our environment, it's our culture, it's our work, it's our family, it's our physical health. All of those contribute to our well-being. And so our resources need to reflect that.
Yeah, that's right. And you have a lot of experience as a psychiatrist here in the NT. And what are your top tips for young people to maintain mental health and well-being?
Well, I think it's really important to stay connected. So one of our primary resources starts with the people in your life that keep you strong. That's the first conversation we have with people in this little brief treatment that we introduced some years ago and that we've continued to promote. And then the second step is to think about what it is that makes you feel good. So that's all those relaxing activities that you can do. So two things: connection, reaching back to connections that might be feeling a bit disconnected at the moment, staying in contact with those good people who help you to feel good. That's the first thing to do. And that's so important for young people, especially. That's what they really need, is those, especially their peer relationships and support. But that second point, you know, that's where it's about doing the exercise, if that's what makes you feel good, finding some relaxing activities, some creative activities, looking back at what helped you to feel good and doing more of it. That's the second step in our approach. And I think for these days, I'd also say, if you can, get outdoors, because the sky, the wind, the trees, the birds, the animals, so good for us in terms of helping us to relax and helping us to tune out some of the more challenging messages we're getting. And there's my last tip, which is turn the news off.
Yeah.
That's just, we don't need to stay as in tune as we think we do. Turn it off, limit your screen watching, and listen to something that's far more relaxing for you.
Yeah, well, I need to take these notes myself. I think that's really amazing, not just for you. A little birdie told us as well that you are very creative in your spare time. So what sort of things do you do outside of work to maintain a good headspace, and what benefits do you think creative activities bring to you, and what can it bring to young people listening as well?
Yeah, I'm obviously, we all have ups and downs. I'm not saying, that when I'm having a down, this is what I do. So my painting is really important to me because that links me with the outdoors, because I love the territory, love the colours, love the birds. And so I paint. I turned a bit abstract. I think you can see the abstract behind me. This was a phase I went through last year as the world started teetering a little bit. I found abstraction really quite fun. Apart from painting, which is something we can do inside, which is great, and I'm talking about remembering, the outdoors. That's been great for me. But music is another way that I spend my time. Set myself the challenge of trying to improve in the music space, and that's been a great journey for me. Everyone has their own sort of creative bent, and I encourage people to draw, to play, to exercise, do what's right for you. But for me, those have proven really useful, and I'm still feeling good most of the time, despite what I was just saying earlier, Lateesha. It's such a challenging world. We have to readjust our plans all the time, everyone. We can't be sure what's going to happen next week, and that's such a challenge. But yeah, some good tips, some things that work for me, so I'll keep doing them.
Yeah, and you're right. We definitely learned that with this Youth Health Summit. We're now going online. So, it's just showing the changing times and how we have to adapt as well. But thank you so much, Tricia, for joining the podcast today. Do you have anything else you'd like to add before we go?
Oh, no, just I'm so pleased that we're having the Youth Health Summit, and thanks, Lateesha, for having the chat. It's been great.
Thank you so much. That was our second episode of our Menzies Youth Health Summit research podcast series for the NT Youth Health Summit initiative called Youth Choices, Youth Voices. It is always so inspiring to hear what our researchers in Australia are doing to make a difference for young people, for their health and wellbeing. Thank you. If you can, please support the Youth Health Summit initiative by getting in touch via the Menzies School of Health Research website. Thank you for listening. Please join us again next time.